The House of Representatives today voted, as expected, to expand the children's health insurance program known as SCHIP. The program is designed to give health coverage to lower-income children whose families can't afford it. But some Senate Republicans say the new law expands coverage to more than 500,000 illegal aliens. We'll have that report exclusively here tonight. Lisa Sylvester has the story.
The vote in the House, 289 to 139. The legislation would enroll 4 million more low-income children in the state-administered health program known as SCHIP.
This bill is a down payment on health care for all Americans.
Democrats passed similar legislation in the last Congress, but the bills were vetoed by President Bush. Now, with a Democratic president moving into the White House, congressional Democrats are expecting a different outcome.
At a time of economic crisis, nothing could be more essential than ensuring that children of hardworking families receive the quality health care they deserve.
But conservatives on the Hill are blasting the bill, charging that the legislation will make it easier for illegal aliens to receive government-paid health insurance.
The whole verification process that should be in here to ensure that only American citizens and legal residents are entitled to these benefits, no verification system to speak of, is contained in the bill.
Fiscal conservatives take issue with the price tag and argue a proposed 61-cent federal tax on cigarettes will not generate enough revenue to pay for the program, estimated to cost at least $32 billion in the first 4.5 years.
They're throwing around money around here like it's monopoly money. You know, we're talking about the $700 billion, and we're talking about this new money, and we did a lands bill for $12 billion. I'm afraid we're doing a lot to hurt the future of our country.
And now that the SCHIP legislation has passed the House, it heads to the Senate. The House bill also contains language that would allow children of legal immigrants to receive benefits even if they've been in the country less than 5 years. Now, the Senate bill does not include that language, but it is expected that an amendment will be introduced. A Senate vote could happen within the coming days, and President-elect Obama has indicated that he will sign the legislation. Lou?
Well, I mean, there's no surprise in that. I suppose that it is becoming increasingly clear to every American, irrespective of their ideological viewpoint, their partisan view, whether Republican or Democrat, independent, that we're at a new stage in this country's existence. There is no moral imperative whatsoever in Washington, D.C. to constrain spending. I mean, if we can give trillions of dollars to our banking industry, to Wall Street, billions upon billions of dollars to support retention bonuses, why in God's name is there any moral resistance of any kind that is legitimate, any intellectually consistent argument against paying for the health care for anyone in this country, whether legal or illegal?
Yeah, you know, and that's a point that Senator DeMint made, which is $35 billion. Under normal circumstances, that is a huge amount of money. But in light of $700 billion here, $350 billion here, he says that they're willing to pass this amount of $35 billion without even sneezing at it because comparatively it's not considered that significant of a sum, Lou.
And indeed, I think we have to say objectively that it is frankly nothing by comparison to what has been thrown at this bailout. And it is also a clear statement as to what a period that we have entered, an extraordinary period, and it is one that I think the nation needs to be sharply focused upon because, as the saying goes, during this campaign, change is upon us. Thank you very much, Lisa Sylvester.